Hi, I'm Margaret Danico, VP of Nursing and Clinical Services at RMA of New York, and I'm here to talk to you about directed sperm donor services with our third-party team. In case you're wondering, third party simply means that you're planning on using a third party to help you achieve your family planning goals. We're a team of nurse practitioners, physician assistants, registered nurses, and fertility care coordinators who work alongside your fertility physician at RMA of New York. The purpose of this video is to introduce you to the process of using a directed sperm donor at our practice. Donor insemination refers to when a sperm donor is used to help a couple or a patient conceive. Sperm donors can be known, which are also referred to as directed, or unknown, also referred to as de-identified or non-identified. In known or directed sperm donation, the sperm donor is known to the recipients, such as a family member or a close friend. In de-identified or non-identified donation, sperm is purchased by the recipients via a licensed sperm bank. This process can feel daunting and overwhelming, but we hope that by the end of this video, you will feel informed and have a better idea of what to expect. You will also be able to click on a link or call the office to set up a call with a member of our team so you can ask more questions. The first step in the process of using a directed sperm donor is for you to introduce us to your donor, either via email or phone. We will send them some registration forms so that we can create an account for them in our system. Once this paperwork is completed, we will be able to schedule them for their initial screening appointment. This will help us determine FDA eligibility. This appointment consists of a panel of FDA infectious disease blood work, a full-body physical exam, as well as a sperm cryopreservation or sperm freezing. The sample collected at the initial screening appointment will be split into several vials and frozen for a minimum of 6 weeks. And when this period has ended, your donor will be invited back to complete post-quarantine blood work. This consists of the same blood work collected at your donor's initial visit. This is to confirm that there were no infectious diseases lying dormant at the time of the collection. Once the post-quarantine labs have been completed, our team will officially clear the samples for use, and your doctor's fertility care coordinator will be able to help you schedule your IUI or IVF cycle. In addition to the screening appointment, your donor will also be required to fill out a lifestyle risk assessment referred to as the high-risk questionnaire. This helps our team determine FDA eligibility by assessing whether or not the donor is an increased risk to communicable diseases. Of note, there are many directed donors who are deemed FDA ineligible for various reasons due to this form. However, with proper counseling by your doctor and potentially signing an additional consent, this may not prohibit you from using this donor. Next, I'll answer some frequently asked questions we receive from patients about directed sperm donation. How many IUI or IVF cycles will we be able to perform from one collection visit? Typically, our lab splits sperm donation samples into 3 to 6 vials per donor collection. Typically, 1 vial is used per cycle, so a collection sample that resulted in 6 vials could potentially be used for 6 cycles of IUI or IVF. What are reasons my donor could be deemed ineligible? There are several reasons a donor may be deemed ineligible for donation. These include lifestyle factors, living in Europe from 1980 to 1996, having an STI within the last 12 months, having a disqualifying vaccine within the last 12 months, among other factors. Do I need legal representation to proceed with a known sperm donor? Legal representation is highly recommended when using a known sperm donor. Sperm samples that are collected at the initial appointment are left in the name of the recipient at the initial screening appointment. This relinquishes the sperm donor's ownership of any embryo created with that particular sample. The third-party team at RMA will happily provide you with references for reproductive lawyers. While this process involves several steps, our team is here to guide you through. We hope that you found this informative, and if you have any questions, please call our office to arrange a call with a member of our team.